There's no escaping Ebola in Sierra Leone, and those attempting to lead some semblance of normal life are finding it almost impossible. Mohamed Kamara is a wholesale trader in Freetown.
Well, for right now, business no day.
Right now, business is very difficult. Most of our bulk buyers who come from the provinces are not coming to town because their areas have been quarantined and prices are very high.
There are now no known Ebola-infected cases in America, but there are some 300 people currently being monitored for signs. But here we can rest easy that Ebola has been brought under control for now, because what is happening in Sierra Leone at this very moment should have America and the world remaining on edge as a country and its people implode. Welcome to MidPoint. From Sierra Leone, he is the executive director for Fambul Tok, an organization dedicated to advancing peace in war-torn regions such as Sierra Leone. Ground zero in the fight against this incurable disease. John Caulker joins us. John, it's a pleasure to see you again.
Thank you for having me.
John, it was just a couple of days ago that we were told, according to the World Health Organization and others, that apparently in Sierra Leone, the number of Ebola cases was leveling off. Things were getting better. Then suddenly on Sunday, we heard news that the cases had jumped dramatically, and all of a sudden the infection rate was not slowing, but it has been increasing. What has happened in the last week or so that has brought about such a huge jump in the Ebola cases in Sierra Leone?
Thank you. The situation is, earlier on, we thought the burial process has the highest possibility for infectious cases to people. However, we've realized now that it has to do with the trust in communities. People who have come into contact with Ebola victims are afraid to come forward to be tested. So they instead run to other communities, and that's why the disease is spreading around the country. So the challenge now is, how do we fight this battle with a human face? How can we ensure that people have confidence in the medical system, the medical process, that if they show up early, they have the likelihood that they will survive. But in the absence of trust in these communities, it is a problem. Because in a village, for example, after 4 or 5 people are taken to a treatment center and they don't come back to the community, others will find it difficult to show up. And the burial process is also a huge challenge, which contradicts our traditional processes. Our tradition is, when someone passed away, we need to be very close to the individual. We need to mourn, we need to church. And now the Ebola virus has made it impossible for people to touch their loved ones. So this is part of the reason. The trust, the burial, some people are burying their loved one at night, which is very bad. So what we have done is put in place mechanisms to monitor the burial processes around the country. So hopefully things will calm down in the coming days or weeks.
How much of the problem is the government there, John? Because we now hear that more than 400 health workers are going on strike at the clinic in Sierra Leone because the government is not paying them what they agreed to pay them.
That is a huge challenge. The government will argue that they don't have the resources, but for us as Sierra Leoneans, we believe a lot of resources have been poured into this fight. So it's difficult to explain. However, I think it also has to do with the chain of command from the National Ebola Response Committee to the hospitals around the country. So sometimes, somewhere, the money gets stuck. And I believe the government should do more to pay these people directly, because they are risking their lives. And I believe they deserve to be treated better, and the government owes them their backlog. So the government should do everything possible to pay them their money.
Very briefly, though, John, is the government able to do it? Because it has been rife with graft and corruption for decades.
This is the fact that, yes, there has been series of finger pointing on the government in terms of corruption. However, the president will tell you he is doing everything possible to combat corruption. But I think he needs to do more. He needs to be seen to lead the fight. And for now, it's just a stark reality that corruption is part of the challenge, and we expect the government at this point in time to lead the fight against corruption.
All right, John, I'm going to hold you there for just a moment. We'll break in back with John Caulker. We'll dig into what America has done and is contemplating in Sierra Leone and what looms as the next humanitarian crisis in that country. And at 51 minutes after the hour, and telling it like it is, one blowhard cable talker who deserves everything she hopefully gets from a newly minted lawsuit.